I'd like to give you some post-op instruction after having an extraction today. I'd like you to be very careful if you go home and have a hot drink, because your lip and your tongue will be numb after the procedure, and if the temperature is too warm it will burn your lip and tongue, and that will be more painful than the procedure, which you won't know until the numbness is worn off. I'd like you to take it easy today. I'd like you to go home and rest. I'd also like you to keep up your pain relief for the first 24 hours. We will provide those for you. You can alternate them every 3 hours. We normally give you Nurofen, which is a 400 milligram, and then we would give you Cocodamol, which contains codeine and paracetamol, and you could take those 3 hours later. If you decide that you don't want to take the codeine because it can make you drowsy, you can take your Nurofen one every 4 to 6 hours, and if you keep that up for the first 24 hours then there's no need for you to be in pain. Also, it's an anti-inflammatory, so it will help with any bruising and swelling which you may get. I'd also like you to not rinse your mouth out today. As I said before, you can drink as normal, but we don't want you to dislodge the blood clot. So what we'd like you to do is start hot salt water mouth washes from tomorrow, which is 2 teaspoons of salt in a tumbler of warm water, and if you could do that 4 times a day please for a week, and that will help with any healing that you may have. I'd also give you some Sterile bite packs, and what I'd like you to do is, if it did begin to bleed, we'd like you to place one where we've taken the tooth out and bite down for 10 minutes, and the pressure of that should stop the bleeding. However, if that doesn't happen, if you'd like to give us a call, we will advise you what you need to do. We'd like you to avoid alcohol and cigarettes and any strenuous activity, including exercise, gardening, going to the gym, for the first 24 hours to a week after the surgery. I'd also like you to complete any antibiotics which the dentist may give you, and finish the course, which is very important. We would need to make you a review appointment if you needed any sutures, and this would happen 1 week after the surgery.